looking at quality education, among many other challenges. I want to start off with the fact that what do we need as a starting point to move towards achieving good health?
When you look at the way we define health, we say it's a state of physical, mental, and social well-being, and not just the absence of an illness. So what does this tell us? It tells us that, look, health is not only about good health or having good health care. It's not only about the health system. It's about so many things that come together. So if we must have good health, the starting point will be actually having this multidisciplinary approach, which looks across so many things.
Also very aware of my own cultural humility, and I have to be very honest that the U.S., why some people look to us as having all of the solutions and more money than anyone needs, we have not achieved global health or universal health. We still struggle as the most developed country with one of the worst maternal death rates in any developed country. It's on the rise, unfortunately, not on the decline. And we have to look at the social determinants of health, the structures that are leading to that particular demise and concern. And it is, as the doctor said, beyond just health care. In general, if you go to our hospitals and a woman experiences a health crisis during delivery, the management of that health crisis is usually quite well done. But we're discovering that our citizens are experiencing high rates of obesity and diabetes. It's a lifestyle and culture problem across all of our races. But there are certain racial disparities and ethnic disparities in our access to care, in our poverty levels. So we struggle as well to achieve better health and to work toward the goals. So I'm happy to participate in the conversation. I can honestly tell you we don't have the answers, but we have the desire to participate in the conversation, and I think that's what will move us all forward toward better health.
Started to focus on research that is rooted in people's lives, is rooted in the experience that people have, and research, therefore, that has an impact on people. So beyond the publication of the research, what is happening with the output of that research. The other thing that we've done, Maggie, and this is from independent verifiers, is that we've begun to change the culture within the university, the way in which we do things, the way in which we conduct research, the way in which we inform education. One of the key things is that we need to have an education system and a curriculum that's much more flexible, much more agile. So in resource-poor settings, the luxuries of medical curricula and nursing curricula get squeezed out often with an obsession with knowledge-based intended learning outcomes. So we lose the issues around understanding the healthcare system. And we know that many students who come to universities don't always have experience of the healthcare system in their country, from village level right up to tertiary teaching hospital level. So we need to help people understand the system. We need to help people understand the model of healthcare. So curative model of healthcare is probably pretty outdated in the world. We're looking at a much more palliative model of healthcare.
My name is Letla Khanola from South Africa. I'm a pharmacist by profession, and I work in PhD facilities now in a particular province, and we're working on ensuring medicine availability in primary healthcare. So my question will touch on basically almost all the goals. As much as we are healthcare professionals, we're mostly focusing on goal 3. But how about at some point we need to take off our heads as health professionals and look at all other goals. For example, whether you are a pharmacist, an engineer, or wherever, all the goals in a way are interlinked. And if we are able to build capacity in civil society, we can start by schools, primary, high school. If you teach the kids how to wash their hands, how to eat healthy, and how to save electricity and water. Those things eventually will work out to assist in other goals and also ensure sustainability. As a child, you grow up, this become a way of life. I think in terms of sustainability, we can look at it in that way, but I just want to ask, how much support do we have from our the education side? In terms of training, our ministries of education, to have enough support to train civil society, kids, and all other individuals, except professionals, to assist. Because for us to achieve all these goals, we all have to work together, professionals or not. Because if we can all work together, we will see all these goals as they interlinked, and we see the last goal which talks about partnerships and allow sustainability. So I just want to ask, how much support do we have from the Ministry of Education in terms of capacitating and allowing other civil society members to be able to participate and assist in implementing these goals across the globe?
First and foremost, I want to remind you that WHO is a member state organization. So the people you see in WHO, they are only the secretariat. All our decisions are taken by the ministers of health of your countries. So it's not by us. So that is one of the things, we're doing. And because of that, we have the World Health Assembly, where we, based on our work in the countries, we look at what the issues are, and then we present them to your ministers of health to say, look, this is what the situation is. This is where we think you should put money. This is where we think politically you should act on. So this is one way. Of course, in each of the regions, we have 6 regional offices. We have what is called the regional committee. They take place once a year. Again, ministers of health, they are the ones that take all the decisions. And what we do is that we provide them the evidence based on our work and our partnership, to take decisions.
My name is Christophe Mumio from University of Ibadan, Nigeria, and I'm a director at the Federation of African Medical Students Associations. So I have 2 questions. The first question is about interprofessional rivalry, especially in my country, Nigeria. There's a lot of rivalry between nurses and doctors. So it's very hard getting the different healthcare professions to work together and to achieve the sustainable development goals. So maybe Dr. Olu has, at least since he was working in Nigeria before he came, if he has an idea of how we can actually fix the interprofessional rivalry. And the second question is on cultural perspective and healthcare, SDG 3. For example, we did a breast cancer awareness program, a Pan-African awareness program at the Federation of African Medical Students Associations recently. And traditionally, we do go to cities for free screening exercises and awareness programs. But this time around, we're like, let's go to the remote communities, a very remote community in Ibadan, like Anojaoba. So what we realized there was that people actually don't want healthcare. We're doing awareness programs and screening exercises, and people are like, no, that's not what we want. We want money. We want good food. We want this. And we're very surprised that even people that we're trying to help, they actually don't want this. So how can we fix this? How can we get around to actually even getting people to want healthcare interventions? Thank you very much.
Great questions, and far too much content for us to digest in 1 hour and to give you good answers. So we will be using